I'm Pamela Cowan, and I'm one of the Leader Post health reporters. As a health reporter, I've written stories about mental health issues, and inevitably people phone with questions or concerns, or they're looking for information. And after a while, it became quite apparent that there's a real need to let people know what resources are available and to highlight the problems that so many people appear to be having right now in finding those resources. Over the course of the last 3 months, I've done more than 100 interviews. People were very courageous in sharing their stories, and I say courageous because part of the stigma that surrounds mental illness is the fear that you're going to be labeled as crazy or violent. So people were very forthcoming with very personal details about their lives, and we hope that our telling those stories will make a difference in the services that are offered, both in urban centres, rural centres, and remote centres in Saskatchewan. Over the course of the next week, the Leader Post will run stories that will take a look at what was, what is, and what will be, or what could be, the future of mental health services in Saskatchewan. So we'll start with speaking with a lady from Weyburn who was first a patient at the Weyburn Hospital, then she became a psychiatric nurse, and while she was a patient at the hospital, she met her father, who she hadn't seen for years, and a grandfather she'd never met. A very intriguing story. We'll take a brief look at the 50s, when the province enjoyed an international reputation for its mental health services, and we'll then contrast that with where we are today. And we've traveled to 2 locations outside of Regina. We went to North Battleford to take a look at the aging Saskatchewan hospital. There's been calls for that hospital to be replaced. So we went and we met the CEO of the health region there, the director, talked to some patients. And what we saw was, as the staff say, good services, good people, bad building. The second major trip that we took was up to northern Saskatchewan. We went to La Loche, to Clearwater River Dene First Nation, and Buffalo Narrows. And what we wanted to do there was talk to people about why the incidence of suicide is 3 times higher in northern Saskatchewan than southern Saskatchewan. Readers will hear from 2 mothers who each lost a child to suicide, and as well as hear from some of the healthcare professionals who are working very hard to make a difference in the lives of northern residents, as well as learn about the isolation that's up there. Quite often, police officers are the first to respond to a mental health crisis, so readers will learn how RCMP and the Regina Police Service members are trained to respond to those mental health crises. We know that depression knows no age limits, so we'll be taking a look at 3 young mums who suffered severe postpartum psychosis, and then we'll look at the other end of the age spectrum and look at seniors and how depression affects them. The Leader Post made an enormous commitment to my working on this series for the past 3 months, and certainly the research grant that I received from the Canadian Institutes of Health Research funded the travel to northern Saskatchewan and to North Battleford. Without that funding, medium-sized newspapers such as ours just wouldn't be able to go the distance, so to speak. It's my hope that these stories will get people discussing mental illness, and through those discussions, hopefully, some of the stigma that surrounds mental illness will dissipate. Mental illness really isn't a whole lot different than a physical illness. If you break your leg, you go to an emergency department. But because of the stigma that is attached to mental illness, people don't talk about it. Therefore, unfortunately, 2/3 of people who have mental illness don't seek professional help. What I found is that people have been amazingly courageous in sharing those stories, and so for that we thank them, because it's going to make a difference.